everyone, I'm Dr. Jing Liu from Shantou University Medical College. Today, we will continue the talk about respiratory physiology. We have covered the mechanism and evaluation of breathing. What will happen after air gets into the lungs? For patients with asthma, what are the consequences of obstructive air flow? Today, we will go through gas exchange in the lungs and tissues. After this session, I hope you can describe the mechanism of gas exchange and outline the influencing factors. In the whole process of respiration, gas exchange occurs twice. One is between the alveoli and the pulmonary capillaries, and the other is between blood and the tissue cells. O2 is transported from the alveoli through capillaries and to the cells, while CO2 takes the reverse route. Actually, simple diffusion is the basic mechanism for effective gas exchange. The driving force is the difference in pressure. The partial pressure of each gas depends on its concentration. For example, the partial pressure of O2 is equal to its percentage in the atmosphere multiplied to the atmospheric pressure, which is about 159 mmHg. But the partial pressure of CO2 is only 0.3. During gas exchange in the lungs, gases will move from a region of high partial pressure to one of low partial pressure. Look at this slide. The respiratory membrane is constructed by the following layers: the layer of fluid and the surfactant to reduce the surface tension, the alveolar epithelium, and the basement membrane. Interspace between the alveoli and blood vessels, the capillary basement membrane and the endothelium. Normally, the respiratory membrane is very thin with high permeability and large area, providing favorable condition for gas exchange. The respiratory membrane itself will affect the gas exchange in the lungs. First is its area. We know the total alveolar area is about 70 to 80 square meters. However, only half of them are involved in gas exchange with quiet breathing. The rest serves as area reserve for gas exchange in excess or disease when more oxygen is required. Interestingly, the gas exchange is also completed as the first 1/3 segment of the pulmonary capillaries. The remaining portion allows for further gas exchange when necessary. Secondly, the thickness, diffusion distance, also affects the efficiency of gas exchange. The distance is increased in conditions such as pulmonary edema or fibrosis. The diffusion coefficient also influences the rate of diffusion, related to the solubility of the gas and the square root of its molecular weight. So for the same partial pressure difference, the rate of CO2 diffusion is about 20 times that of O2. Of course, the partial pressure difference is also a factor. So finally, this is the equation. Besides the membrane and the characteristics of the gases, the volumes of ventilation and associated perfusion can also affect the gas exchange. The ventilation-perfusion ratio, VA/Q, is used to evaluate their matching rate. We know that the lung ventilation is about 4.2 liters per minute, and the respective blood flow is 5 liters per minute. So the normal ratio is about 0.84. An increased ratio indicates excess pulmonary ventilation or reduced pulmonary flow, resulting in the increased physiological dead space. So efficiency of gas exchange is decreased. How about the increased ratio? It also decreases the efficiency of gas exchange. It is caused by the lowered pulmonary ventilation, resulting in functional artery vein short circuit. The blood does not undergo sufficient gas exchange and thus is less oxygenated. Let's come back to asthma again. Does this disease affect gas exchange? Of course. The contraction of bronchial smooth muscle, bronchial spasm, causes decreased ventilation. The deoxygenated blood fails to become adequately oxygenated. The ventilation perfusion ratio is decreased. In severe cases, asthma can be fatal. In summary, during breathing, O2 moves in and CO2 moves out of the lungs. However, the gas exchange is the important step. The difference in partial pressure is the driving force for gas diffusion through the respiratory membrane. And the area, thickness of the membrane, the diffusion coefficient, and partial pressure difference are the influencing factors of gas exchange. In addition, ventilation perfusion ratio is also decreased in different pulmonary diseases, affecting the important process in the lungs. Here are the references. That's all for today. Thank you and see you next time.